My name is Dr. Margarita Ochoa-Maya. I am a board-certified endocrinologist. I am the medical director at the Rare Disease Business Unit at Amgen, and I am originally from Colombia, and I am an endocrinologist. I've been practicing for about 17 years. Thyroid eye disease is a debilitating disease that affects patients with thyroid disease. So there are two distinct diseases. One is affecting the thyroid gland, and the other one is affecting the eye and the tissues of the eye. And it really impacts patients by disfiguring and changing their appearance, as well as really compromising their vision. That actually impacts their quality of life. And really, these patients get significant burden from thyroid eye disease, and it is our role to identify it and educate about it so that we can treat this very debilitating disease. Typically, 40% of patients with Graves' disease can actually have thyroid eye disease, and this usually presents by having significant sensitivity to light, grittiness and pain in the eye, having actually a moment in which their eyes are pushed forward. That is a term called proptosis, and with that, then they lose that binocular vision or the ability to see one, and then the patients start having double vision. And this clearly impacts their day-to-day activities as well as their mental health, and drives isolation, some caregiver burden, and really impacts their ability to work. So it's very important for us to identify this disease and treat it appropriately. Unfortunately, until recently, we only had very few treatments for this, but patients with thyroid disease commonly visit the endocrinologist, especially patients with Graves' disease. So our campaign is to make sure that everyone with Graves' disease has an eye evaluation with the endocrinologist. Our campaign is to really get everyone educated around thyroid eye disease so they can actually identify it in their practice and start a proactive approach to thyroid eye disease. The campaign is we talk about TEDucation. So we had a challenge, the TEDucation challenge, and it was a great event in which we saw people participate. We used gamification. People came in to talk about education, but then we had impact. We had a guest patient who is also the CEO of a community where they will help each other. So patient advocacy is at the forefront of what we do. We always put patient first, and we wanted to educate endocrinologists about their role in identifying patients with thyroid eye disease. It was so well received. Actually, we had a standing room, and what was interesting is through education, through gamification, we can identify certain gaps. And we also identified that the one question that a lot of people had wrong was the recent ATA and ETA consensus, which talks about the role of the endocrinologist in identifying thyroid eye disease. So we were really excited to see that not only were we engaging with our constituents here at the Society, but also providing education and motivation to go in and dig deeper into the disease and learn more about it. This was a good pilot, and we see that other disease states have been introducing gamification. We have an opportunity to engage with fellows who are now trained under new evaluation, new guidelines. And so our goal is to really engage and activate the endocrinologists so that they can be more aware of thyroid eye disease and engage with the patient sooner rather than later. So we plan to do this in others, but we wanted to really see the insights we gather here, and now that we had such a successful event, we'll probably do more. There is a situation in which it's actually an urgent need. So if a patient has significant vision changes, sudden onset of double vision, and more importantly, changes in color vision, we need to work with our ophthalmologists, our oculoplastic surgeons, and our neuro-ophthalmologists to talk about a serious condition in which they can lose their vision. So there is definitely a concern to make sure that endocrinologists not only look at the thyroid when they see a patient with thyroid disease and Graves', but also look at the extrathyroidal manifestations, and that would be in the eye as well as in the extremities. So yes, by creating awareness, we're increasing the impact and treating these patients sooner rather than later, and taking a proactive approach rather than a reactive approach to thyroid eye disease.